chiropractors like doctor help patients elevate pain, improve mobility, and enhance overall well-being. So chiropractic care is particularly important for prenatal moms, babies, and children, as it can help with development issues, colic, and other common health concerns. So, Dr. Schlebusch today will share her expertise in pediatric chiropractic care, which is so invaluable, and her registration with the Pediatric Chiropractic South Africa underscores her commitment to providing high quality care. So today she'll share her insights on the benefits of chiropractic care and how it can improve the lives of individuals and families. Doctor, we're looking forward to your expertise and guidance, and we look forward to having a conversation with you and your inspiring work. So, what inspired you to specialize in prenatal and pediatric chiropractic care?
Thank you, Shabnam. My inspiration was definitely when I had my own children in 2012. My little boy was born special little bundle, as every mum says. But my little boy had colic, and no matter what we did, we couldn't get him to be a happier bub. He cried the usual colic times in the evening. Unremitting crying. We'd feed him, we'd burp him, we'd walk with him, everything. And we just could not get him to settle. So a colleague of mine did help me with him. So he did have some pediatric chiropractic, but I just kept on thinking there must be more. I know a lot of moms say it's normal for your baby to cry for 6 weeks, and sleep-deprived Helen did not like that opinion. So that was the beginning of my exploration into what more can we do for babies from a chiropractic perspective. Babies aren't just small adults. Babies have got their own way of growing. They have got very soft joints or soft bones because they're predominantly cartilage. Babies' nervous systems are developing at such a rapid rate in those first few months of their lives, and their brain is growing. Up to 70% of the adult's brain is developed in those first 2 years of life. So yes, I've delved down a little rabbit hole from then. And it's been, for me, absolutely mind-blowing as to what we can do for babies.
And tell us, obviously, with the level of care that and expertise you give off in terms of pregnant women, what are some specific issues that your practice can help with?
So pregnant mums can battle with pubic pain, sciatica, back pain, because their bodies are expanding and growing a little baby. We tend to forget how much physiological change is happening over in the pregnant woman's body. And what we can look at is your pelvis in particular starts to loosen up with the hormone relaxin. The relaxin targets your ligaments that support your joints, and when your pelvis starts to relax and then expand with the weight of the baby, if you've had a prior fixation in your pelvis, that tends to pull the ligaments unevenly. So from a chiropractic perspective, we use specific techniques to see where mum's alignment is sitting, and then we just introduce some change. Just on that note, sorry, I'm talking around in circles, but I want to say that from a chiropractic perspective, we actually look for areas in the spine and the pelvis, or actually in any joint, but our focus is on the spine, to see if there's any areas of joint dysfunction or the joint isn't gliding as well as it should do. Our bodies are designed in a beautiful way for every little joint, every little muscle, every little nerve functions beautifully together. And if for whatever reason, it might be a car accident, it might be a fall, it might be really poor posture when you're sitting, that develops tightness in our spine and in our pelvis along the way. if we can, if from a chiropractor perspective, find that tightness in the spine or in the pelvis or in any joints and restore the natural motion that our biomechanics were built to have, then we can have less nerve irritation, less pelvic misalignment, less pain. So then we go to the pregnant mum and relaxin goes through your system, and that's actually can exacerbate something that's been sitting there for a long time, and then you develop the pain because now your body is changing over the time that you're growing your baby.
And in terms of children, what age can they start seeing you as a practitioner?
From the day they're born.
Fantastic. And in terms of pregnancy, I know it's actually Breastfeeding Awareness Month, and we highlighted this at my last talk. How does your practice support fetal development to prepare the body for a healthy pregnancy?
So again, I go back to the way the pelvis is sitting. If you have a fixation in your sacroiliac joint, that is the joint right at the bottom of your spine where it goes into your hips. If you have a fixation in your area where your joints aren't moving properly, we have ligaments pulling. Your round ligament, which a lot of people know, is a ligament that's very important in your body as you're growing a baby. It attaches to your uterus. And that round ligament attaches to your sacroiliac joint at the back. If you have pelvic misalignment and your baby starts growing in your uterus and the round ligament is pulling unevenly onto the uterus, your uterus can sit in a suboptimal position while your baby grows, and there's undue pressure that is applied to the baby as the baby grows. So from a chiropractic perspective, if we get mum's body as comfortable as possible, we're giving that baby the best vessel possible to develop as they were designed to do when they are conceived.
Are there misconceptions in the community about the use of a chiropractor during pregnancy?
Absolutely, because again, I go back to that hormone relaxin. Relaxin is making our joints more hypermobile in order to give birth to that baby. And there's the idea that chiropractors apply too much force to joints, especially in the instance of a hypermobile joint. But chiropractors are trained to identify hypermobile joints, and we are trained into applying a more gentle adjustments to a pregnant mum. So the amount of relief you can get from chiropractic care is amazing in comparison to sitting in your pain while you're growing your baby.
Yes. And what role does your practice play in supporting immune function and overall health in children?
So immune function is a little bit of a catchphrase at the moment, I find. I go back to how our bodies were so beautifully designed. If we have areas that are in our spines, particularly from a chiropractic perspective, where there's almost like interference, going back to the joints fixation, your nervous system can't fire like it should do. And our nervous system actually allows our whole body to function properly. If your nervous system is having a little bit of a misfire or irritation or whatever it might be from the joints fixation, then your nervous system's not going to function like it should do. And that can go hand in hand with immune function. It can go hand in hand with digestive function. It can go hand in hand with so many different body systems. I can't say as a chiropractor that I make your immune system wonderful because it's not so clear cut. But if we can get your neuromuscular skeletal system functioning as best as it possibly can function, your body systems will function as best as they possibly can function.
And can a chiropractic care help with colic, ear infections, or other common childhood issues?
Absolutely. So talking about babies, I said earlier that they aren't just small adults and their little bodies are uniquely for them. When we give birth to a baby, whether it becomes a C-section delivery or natural birth, delivery, where the forceps are used, it's traumatic for both mum and baby. So what can happen in that process of giving birth is your baby can have joint fixations or irritation, particularly on their neck. I found that lots in my practice. It's particularly the upper neck that we babies can have fixations in their joints, and that can lead to neck stiffness, and they can't have full range of motion, and therefore their latch might be a bit of a challenge. Their burping might be a little bit of a challenge. They could just be very uncomfortable because their neck is a bit sore. So chiropractic care, removing those fixations, helping that baby feel a bit more content, a little bit less painful, helping the baby latch better, helping the baby feed better, all contribute to reduction of symptoms like colic.
I can hear how passionate you are about your patients and especially the younger kids. Can you take me through a scenario of how you will tailor a care approach from a chiropractic perspective with dealing with the little kids?
Okay, so when mummy and daddy bring baby to me, very often I have granny coming in too because everyone's quite fascinated with what I do. We sit down and I do a full medical history. I found out how that pregnancy was for them. I found out if there were any interventions made, if mum had any medication during her pregnancy. I also do a full physical on the baby. We weigh the baby and we do head circumference measurements, and also check a few cranial measurements on their heads. Thereafter, I do a little bit of a spinal, well, not a little bit, I do a spinal assessment on them, and I then chat to mum, dad, granny, whoever came with about what I found in that baby. Then if that baby does not have any fixations in their spine or any problems with their nervous system, I tell the parents, you've got a beautiful baby, you're doing such a good job, and I don't need to treat the baby. But if that baby does have a spinal fixation in particular, then I'll explain how I will remove that fixation. Our treatment of babies is so gentle. It's almost like applying pressure to see if a tomato is ripe enough. The amount of pressure we apply is very, very tiny. But it's about just settling down that joint, getting that joint to glide the way it should do in an infant. And then that nervous system can fire like it should do.
We're going to have a quick break, and when we're back, we will unpack more exciting conversations. So stay tuned, listeners. Our very own renowned chiropractor, Dr. Schlebusch, will share insights into the world of spinal health and wellness. Don't miss it. We'll be back in a few minutes, inshallah. Joining me today is Dr. Helen Schlebusch, a highly respected chiropractor with a master's degree specializing in prenatal, pediatric, and general chiropractic care. With a private practice in Pietermaritzburg, KZN, Dr. Schlebusch has been dedicated to helping patients of all ages achieve optimal health and wellness. Her passion for her work is truly inspiring, and we're excited to have her share her expertise on my show, The Pulse Show. Welcome, Doctor.
Thank you, Shabnam. Hello, listeners.
Let's dive straight in. What are some signs that a child may benefit from your care, and when should parents consider bringing them in?
So we can look at babies and those babies that have feeding difficulties or latch difficulties. I see a lot of babies that leak milk when they're drinking, whether it be from the breast or the bottle. We can have babies that suffer with colic, which is that crying for 3 hours in the early evening, more than 3 days a week. Babies with sleep issues, with those babies that have their days and nights confused, where they love sleeping during the day and they're wide awake during the night. Torticollis, which is a turn of the head, so the head starts to look up into the sky on the one side. Postural preferences, so if your baby's always staring over to the one side, or if your baby tends to hold a hip up higher than the other hip. And then from a children perspective, children also have their milestones that they reach at certain ages. If we have any delayed developmental milestones, we can definitely see if we can help with those babies or those children as well. Kids are always getting bumped and bruised. So if I usually tell my patients, if your child is hitting a new milestone or has had a big knock to the head, bring them in, let's have a look. And if there's something there, we can fix it or we can address it.
And how does a chiropractic care support neurological development and function in children?
We have this catchphrase of the first 1,000 days, and that is from conception to 2 years of age. The amount of neurological connections that are made and the neurological development in those first 2 years, and I reiterate, from conception, is so astronomical. It's absolutely phenomenal to see how much development happens in those years. And to reiterate, if your baby has a fixation, which is our chiropractic catchphrase, if your baby has a fixation in their spine and their nervous system is not firing like it should do, those first 1,000 days will not necessarily have the neural or the optimal neurological development that we can have. So from a chiropractic perspective, during pregnancy, it's important to make sure that mum's body is as optimal as possible, so we're not putting any undue pressure on the baby while the baby's developing, as well as after birth. Birth is traumatic for both mom and baby, so babies can have neck issues from that, and it's important for us to make sure that nervous system is firing as good as it can for those first 1,000 days in particular.
And do you help with patients with ADHD?
That's another thing I can't say yes for certain, but we go back to the nervous system, and if the spine is functioning as good as it can, your biomechanics are firing as well as they can, then that nervous system can develop as well as it possibly can. So we like to believe that it is a huge benefit for all children. It lays down the foundation for what their life will be in the future.
And do you support adults, for example, sporting trees? And can you give us some examples of how you would assist an adult?
Sure. I actually started my practice as a sports-based practice before I had my children. And when you are a sports-focused adult, you put your body through a lot of challenges. From a training perspective, your muscles are tighter, your joints are working at a higher rate. So we have to make sure that the body's biomechanics or neurobiomechanics are firing as best as they could. I have had some sporting patients say to me they come for their adjustment just before they compete because they do get PBs when they've had adjustments done, and that I go back to, it's just the nervous system and the function of the body being as best as it can. Adults, I treat all adults as well. People sitting at their office for long periods of time, also we tend to slouch onto our desk when we're focusing on our computer screen, and we tend to do this little bit of a chin poke. And I found a lot of people who develop headaches can benefit from chiropractic care because we just get the biomechanics right in the neck in particular, and then their headaches get better. We don't only treat patients. We actually give a lot of coaching from how must you sit at your desk, how well can we get your ergonomics, how good can we get your ergonomics. Also going back to babies, when I treat babies, I always give parents home exercises to do. I try to empower my patients so that once I have done what I need to do with their body, they can maintain those biomechanics by focusing on their posture, whatever it might be, or doing certain exercises to strengthen.
And what are some of the challenges as a chiropractor you might experience at your practice?
Challenges can be chiropractic is in its infancy in South Africa. Chiropractic originated in the States, and so I do find that a lot of people don't really know what we do. So from that perspective, it is hard to get people to understand what we do, people to follow through with protocols, whether it might be an exercise program that I give patients afterwards. Another challenge I do find is pretty much that follow through with giving patients exercises to do and telling them they'll be better when they are stronger. And sometimes they feel that, no, the chiropractor must actually just make me better. I don't need to do something when I go home to keep me better.
Can you tell us about the techniques you would use at your practice?
Absolutely. I modify my techniques according to what patient is in front of me. We do, it's called high velocity, low amplitude adjustments. That's the main focus of chiropractors, is to adjust patients' joints. So when I'm treating a healthy adult, I will be using the chiropractic adjustments. When I'm treating infants, I use, like I alluded to earlier, my very light pressure, the right tomato pressure, and some chiropractors use instruments to adjust. So those patients that are very nervous of an adjustment itself, I have a device called an activator, and it's a spring-loaded device. So it sounds a little bit intense, but it's actually very, very gentle on the joint. It just applies an impulse to the fixated joint to get that joint movement. In my practice, I have to do quite a bit of soft tissue work on my adult patients. So if dry needling is needed, then I do dry needling in the muscles. I enjoy doing soft tissue massage because I find that patients feel so relaxed afterwards. And there's another way of working with the. I also add in a little bit of traction if we are dealing with disorders or any neurological issues.
And what are some signs that a child may benefit from chiropractic care, and when should parents consider bringing them in?
So those, I think we chatted about the feeding issues. If babies are having trouble feeding, then that is definitely an option to bring your baby to see a chiropractor if there is no other medical reason why they would have difficulty feeding or latching. I find, particularly if we're going to talk about school-going children, those children that are very sporty, they tend to not necessarily condition the kids correctly. So a lot of children are literally going from one sport to the next, from term to term, and those children really struggle with impact into their muscles and their joints. So I do see a lot of school-going children because of that high demand on their bodies. And from a treatment perspective, I include a lot of conditioning and core rehab for school-going children.
And how do you collaborate with your other professionals, with the team that refers to you, your gynaes, your pediatricians and lactation consultants, to provide comprehensive care for pregnant women and children?
So yes, gynaes refer to me because when a preggy mummy is sore, she's not a happy mummy. So we do, and it's a conservative care approach, non-invasive. We do try to avoid giving pregnant mums medication. So from a chiropractic perspective, that hands-on therapy can help a lot. And then from referrals from other pediatric professionals, healthcare professionals, I mostly get when those babies have got those postural changes that just don't want to go away as the baby grows. I love communicating with with other medical professionals. Often, if I've had a patient come to see me who has seen another medical professional, I often send off a little referral letter to say what I found. And I feel at the end of the day, it's about the patient. That patient needs the best care they can possibly get. And if I'm not the person who can give them that care, then there is somebody that can. And it's my job to be able to send that patient to the person who can help them the best. And yeah, at the end of the day, they just need to feel great.
That's absolutely fantastic. And would you say that a chiropractor will be able to support a mom during her pregnancy with mental health stress?
Yes. Um, One of my patients actually said to me, yes, she feels like she needs to pay me counseling fees, not chiropractic fees. Um, with pain comes psychological stress at the end of the day. And often just being able to speak about it to somebody, a listening ear, is definitely a huge help in the pain process. But then again, I also, if it's out of my scope, if it gets a bit too intense for me, I do refer on to psychologists as well.
Hmm. Dr. Schlebusch, it's been a pleasure having you on the Pulse Show. I mean, from the information you've given us, you can see your passion for helping others is really contagious. And we're sure our listeners will benefit and have taken notes from your advice. And do you have any closing messages to your listeners and how they can get in touch with you and benefit from your practice?
Closing notes, chiropractors aren't scary. um, and we actually can provide relief. I love helping patients live their best pain-free lives. Um, and then you can contact me. Oh, I don't know my practice number off the top of my head, but I'll leave cards with you, Shana. And my private practice is in Montrose, and I practice alone. I don't have a receptionist, so I always ask patients to drop me a WhatsApp. I'll always return a WhatsApp. I'll give you that number just now, Shana. And then I also have an online booking system, which I found is absolutely amazing. So you can go onto my website, www.drhelen, so it's drhelen.co.za. Yeah, thank you, Shabnam.
To our listeners, Jazakallah for tuning in to the Pulse Show on Radio Al Ansar, Pietermaritzburg. We hope you found today's conversation with Dr. Schlebusch informative and inspiring. Until next time, stay tuned for more insightful discussions and expert advice. To our technicians, both Durban and Pietermaritzburg, Jazakallah for tuning in to our listeners and keeping us connected. Have me and my family in your duas, inshallah. And that's a wrap from myself, Shabnam Ismail. Assalamu alaikum wa rahmatullahi wa barakatuh.